I'm sitting down with an expert for the latest headlines. We're talking about Dr. Arif Kamal. He is Chief Patient Officer at the American Cancer Society. Back with us in studio again. Good morning to you, sir.
Good morning.
You've had a busy week. Last week you were at the American Society of Clinical Oncology's annual meeting. I had to miss it this year, but I'm glad you were there because you can tell us about all the latest studies and what stood out most to you.
Yeah, I mean, this is the biggest meeting that happens every year where most of the major studies get reported out. And, you know, as much as we think about cancer, cancer is a big thing, right? There's 200 different diseases we call cancer, 2 million people diagnosed annually. But what really stood out is how personal and small cancer is getting. We're now looking at individual tumors such that lung cancer, we used to say there's 2 kinds. Now there's at least 50 different kinds, which means there's at least 50 different therapies that we can try. And that also means monitoring people's blood to see if there's resistance to drugs, a lot of ways to pay closer attention to different cancers so that there's not a one-size-fits-all approach anymore.
Lots of different cancers and lots of different cancer treatments. What about, is there any indicator on how those treatments are evolving to become more precise or more tailored?
Yeah, well, there's a lot of interest now in immunotherapy. People might have heard about that. The concept of immunotherapy is that we're going to activate a person's own immune system to attack the cancer. We've always wondered for decades, why is it that a cancer cell and an immune cell sitting next to each other won't talk? Why won't one see the other? And now what we have is medications that pull the camouflage off the tumor so that your immune system can now see it was there all along, and start to attack it. That means less side effects and more precise care.
So that's not a small thing. This is happening now, evolution.
Absolutely.
This is also Men's Health Week. It's an important time to raise awareness about preventable health issues, including cancers. So what can men do to help reduce their risks?
Yeah, so there's a lot of good news here. Men used to be almost 50% more likely than women to be diagnosed with cancer. That's come down to about 15%. Sure. So we've made a lot of progress. But prostate cancer still remains the #1 cause of cancer in men. About a third of all cancers diagnosed this year in men will be prostate cancer. And there's been some confusion about getting their PSAs checked and getting themselves checked. So it's very clear. If you're 45 and older, you're an African-American man or a person with compelling family history, get your PSA checked. Otherwise, 50 and older, every year, get that checked. You know, have peace of mind that prostate cancer won't affect you.
I am a 45-year-old black man. I got my first colonoscopy a few months ago.
Perfect.
Right on schedule, and even better, it was a great sleep. And then second, clear report.
Clear report, perfect. And PSA is next for you then.
It is.
Okay.
I'm on it. I'm on it, Dr. Kamal.
Perfect.
Thank you for always joining us, and we appreciate your time.